Hello, my name is Adan Pineda from section 46, and I'm going to read the exercises between the unit 25 and the unit 34. I am just going to read the answer of some of the exercises. Chapter 25, Mental Illness. 25.1. Complete the table with words from A, C, D, and E opposite. Noun, affect, adjective, affective. Noun, anxiety, anxious. Behavior, behavioral. Dimension, dementia, demented. It's disturbed. Suicidal. 25.2. Make word combinations using a word from each box. Two words can be used twice. Look at B, C, and E opposite to help you. Behavioral depression, eating disorder, major major depression, mental disorder, personality disorder, phy- physical physicomotor retardation, sleep abuse, sleep disturbance, substance abuse. 25.3. Complete the sentences. Look at A, C, D, and E opposite to help you. 1. The way a person behaves is his or her behavioral. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called night dementia. A disorder which is not associated with a pathological changes is functional. 6. An idea which forces a patient to repeat unnecessary actions is compulsion. 25.4. Which symptoms of depression was this patient suffering from? Look at C opposite to help you. Tiredness and lack of interest. Chapter 26. The nervous system. 26.1. Complete a table with words from A, B, and C opposite. Adjective and note. Blind, blindness. Conscious, consciousness. Deaf, deafness. Dizzy, dizziness. Numb, numbness. Lightheaded, lightheadedness. Unsteady, unsteadiness. 26.2. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Double vision, epileptic fit, prodromal symptom, syncopal attack, urinary incontinence, visual acuity. 26.3. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Completed doctor questions. Look at C opposite and the table in 26.1 about to help you. 1. Conscious. 2. Warning. 3. Pause. 4. Stress. 5. Dizzy. 6. Light-headed. 7. Control. 8. Involuntary. Unit 27. The nervous system, part 2. 27.1. Complete the table which words from A and B opposite. Noun, abscess. Adjective, absent. Diminution, diminished. Flaccidity, flaccid. Spacity, spacid. Wasting, wasted. 27.2. A doctor is giving instructions to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. 1. Muscle tone. 2. Muscle bulk and possibility involuntary movement. 3. Power. 4. Coordination. 27.3. Complete the sentence. Look at A, B, C, and opposite, and the table in 27.1 about to help you. 1. Flaccid. 2. Pricks. 3. Muscle wasting. 4. A tick is a form of involuntary movement. 5. A key is often used to test the Babinski response. His coordination was poor. 7. A reflex hammer is used to test reflexes. 8. When something is diminished, is less than normal. 27.4. A patient is brought to A&E in coma, and her name is spoken. Her name is spoken. She opens her eyes, but she does not answer questions or obey instructions. What is her GCS score? GCS score 5. Eye opening to speech 3. Verbal response none 1. Motor response none 1. Chapter 28. Oncology. 28.1. Complete a table which words from A, B, and C opposite in the related forms. Verb, nouns, and adjective. Cure, curative. Exercise, excise, excision, excisive. Grow, growth, growing. Invade, invasion, invasive. Abstract, obstruction, obstructive. Palliative, palliation, palliative. Palpate, palpitation, palpable. Spreading. Swell, swelling, slowing. 28.2. The notes below are about the patient displayed in B opposite. Use them to put the sentences 1 to 9 in the correct order to make the next paragraph of the report. Use appendix 2 to page 20 if you need help with the abbreviations. 6, 3, 7, 2, 8, 4, 5, 1. 28.3. Complete the sentences. Look at A, B, and C opposite to help you. Distance spread. 2. Many symptoms of cancer, such as difficult swallowing, are due to obstruction. 3. The opposite of painful is painless. 4. Malignant neoplasm is called a cancer. 5. Tumors which do not invade metastasis are behind. 6. Secondary tumors are those which result from spread of a primary. 7. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. Chapter 29. Pregnancy and childbirth. 29.1. Complete the sentences. Look at A, B, C, and opposite to help you. 1. A baby is born a week before the EDD is a premature. Termination of pregnancy may be necessary for medical reasons. Termination of pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress is the first stage of labor. Is an indication for cesarean section. Was a breech presentation and delivery was by forceps. 6. A miscarriage is another term for the spontaneous abortion. 7. The umbilical cord was wound tightly around the baby's neck and it was informally stillborn. 29.2. Complete the table with the words from A opposite. Birth, abort, known abortation. Deliver, delivery. Induce, induction. Miscarry, miscarriage. Present, presentation. Terminate, termination. 29.3. Dr. Bennett and SHO is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of births from 29 to above. 1. Terminated. 2. Miscarriage. 3. Delivered. 4. Induction. 5. Present. 6. Delivered. Chapter 30. The respiration system. 30.1. Make the word combinations using a word from each box. Look at A and B opposite to help you. Blood, stained. Breath, sounds. Plural, rub. Productive, cough. Vocal, resonance. 30.2. Rewrite the questions using words that are better known to patients. Look at A opposite to help you. 1. Is it those codes? Loose code? 2. What color is the flying? 3. Is it ever yellow? 4. Have you noticed any blues on it? 5. Any problem with your any problem with your breathing? 30.3. 1. Are the following statements true or false? Give reasons for your answers using your medical knowledge from an A and B opposite to help you. 1. True. Second, false. 3. False. 4. False. 5. False. Unit 31. The skin, the skin part 1. 31.2.1. Complete the description of herpes zoster singles by replacing for medical words in brackets with ordinary English words. 1. Herpes zoster singles. 2. Spots or macules. 3. Small blisters or vesicles. Spots. 4. Spots or lesions. 5. Small blisters or vesicles. 6. Filled with pus, post or pustular. 7. Scabs or crust. 8. Scars or cicatrices. 31.1. Read the description of the rash of rubella and complete the notes. The spots are scatteric pin muscles which appear first behind the ears and on the forehead. The rash spreads rapidly, first the trunk and then the limbs. Location of distribution. First behind the ears and the forehead, then the trunk and the limbs. Grouping, scattered. Type of lesion, muscles, macles. Color, pink. 31.3. Complete the notes for the rash in the photograph and suggest diagnosis. Location and distribution. Windspread and the chest, ahead the abdomen. Grouping, scattered. Type of lesion, small muscles with some scales. Color pink. 31.4. Complete the notes for the lesion in the photograph and suggest the diagnosis. Location and distribution. Below lateral angle of the left eye. Grouping single. Type of lesion, nodule. Color white. Unit or chapter 22. The skin, point 2. 32.1. Write the corresponding medical terms for ordinary English words and say what kind of force is involved. Common word, medical term, type of force. Bruise, hematome, blunt. Cut, inside wound, sharp. Graze, abrasion, blunt. Scratch, lineal abrasion, blunt. Stab wound, penetrating wound, sharp. Tear, laceration, blunt. 32.2. Choose the correct words to complete the description of the injuries shown in the illustration. Look at A and B opposite to help you. There are grazes, contusion, and tears. 1. Grazes, 2. Contusion, and 3. Tears. 32.3. Read the description of the injuries Read the description of the injuries shown in the illustration. Look at A and B opposite and at 32.2 above to help you. There is a lacerality on the on the left shoulder and inside would or could approximately 6 centimeters left above the fixed nipple. 32.4. Complete the sentences. Look at A and B. Look at B, A, B, and C opposite to help you. 1. Sir. 2. Stab. 4. Punch. 4. Sorry. 3. Punch. 4. Superficial. Chapter 23. The urinary system. 33.1. Look at the conversation in A opposite and complete the notes about Mr. Jones. Use medical terms possible. 1. Frequency. 2. Nocturia. 3. Dysuria. 4. Hesitancy. 5. Extreme. 6. Dribbling. Match the patient description 32.2. 33.2. Match the patient descriptions of their symptoms which with the medical terms. 1B, 2A, 3C, 4F, 5D, 6G, 7C. 33.3. Write the doctor questions for each symptoms in 33.2 above. Look at A opposite to help you. A. Did you get any burning or pain when you pass water? B. Frequency. How often is that? C. Hematuria. Have you ever passed blood in the urine? D. Hesitancy. Do you have any trouble getting started? E. Nocturia. Do you have to get up at night? F. Urgency. Do you have any rush to get to the toilet in time? G. Incontinence. Do you have ever lost control of your bladder? 33.4. Describe the findings of the laboratory report in the words. There was a trough of blood, grass, proteinuria, and no cuts. Unit 34, Basic Investigations. 34.1. A doctor is talking to a patient during an ophthalmoscopy. Match the underlying expressions used to expression with similar meanings from A opposite. Okay. A, 3, B, 1, C, 2, D, 4. 34.2. Complete the instructions. Look at B opposite to help you. Grab the cuff. 2. Place the diaphragm. 3. Pump. 4. Well. Engage. 5. Systolic blood pressure. 6. Divate. 7. Diastolic. 34. Complete the text. Look at C opposite to help you. 1. Phlebotomist. 2. Venipuncture. 3. Beast. 4. Tourniquet. 5. Dressing. 6. Breathing. 7. Specimen tooth. 8. Laboratory.